Then let us now learn, hello friends, let us now learn about the level of prevention of disease. Level of prevention of disease, first we have primordial level of prevention of disease. Here there is prevention of emerging or development of risk factors. In primordial, this is done this primordial prevention is done even before the disease has been developed. That means the disease has not yet developed in the individual. We are stopping its development of risk factors itself. The modes of primordial prevention include individual education and mass education. Primordial prevention is the best level of prevention for non-communicable diseases. It is the best level of prevention for non-communicable diseases. Then we have primary prevention. In primary prevention, action is taken prior to the onset of disease. Even before occurrence of the disease, the action is taken. In primordial level, we will take the action even before the occurrence of risk factors. In primary prevention, we take action even before onset of disease. This includes health promotion and specific protection. This primary prevention is applied when risk factors are present but disease is absent. Then we take the primary prevention. It is done in pre-pathogenesis phase of disease. Primary prevention is done in pre-pathogenesis phase of disease. Then we have the next level of prevention, which is secondary prevention. Secondary prevention stops the progression of the disease, and this will prevent the occurrence of complications with secondary prevention. Here in secondary prevention, disease is present, so we will have to, this includes diagnosis of the disease and treatment of disease. Many of the national health programs in India run under secondary prevention of disease. It is an imperfect tool. It is not a good tool, but it is an imperfect tool to control the transmission of disease. So the secondary prevention of disease examples is diagnosing and early treatment of TB, leprosy and STDs, sexually transmitted diseases. Then we have tertiary level of prevention. Tertiary level of prevention is done when disease is present and it is in advanced state. Aim of the disease is to decrease the impairment and disability of disease and thus decrease the suffering. Disability limitation. This includes disability limitation. That means prevention of transition of disease from impairment to the handicapped. We are preventing the transition of disease from impairment to handicapped. Rehabilitation. Rehabilitation is training of individuals to the highest level possible of functional ability. That means we are training the individual to overcome the disability and to undergo proper functioning in his life. That means to do at least his basic things. So this tertiary level of prevention is done in late pathogenesis phase of disease. So we have disease, impairment, disability and handicapped. Disease includes, in disease there is, so if you see, first in disease there is loss or impairs function. That means there is example accidents. In impairment, there is loss of anatomical structure is seen is in impairment, that is loss of foot. Then in rehabilitation, in disability, there is inability to perform normal activity, that is the person cannot walk. Then in handicapped, it will limit the role considered normal to the person. That means the person is unemployed. So this includes the disease, impairment, disability and handicapped. So thank you for watching my lecture. Thank you.